Uterine artery embolization is a modern, minimally invasive treatment for uterine fibroids, especially when surgery is not recommended or when the patient wants to preserve the uterus. The procedure is indicated for symptomatic fibroids causing heavy menstrual bleeding, chronic pelvic pain, pressure on the bladder or bowel, or rapid uterine enlargement. Under local anesthesia, the femoral or radial artery is punctured and an introducer is placed. A diagnostic catheter is advanced through the introducer into the common iliac artery and then into the internal iliac artery. Using digital subtraction angiography, a catheter is guided into the uterine artery. Embolization particles are slowly injected through the microcatheter. These particles occlude the lumens of small arterioles, inducing ischemia of the uterine fibroid while preserving blood flow to the myometrium. The catheters and introducer are then removed. Within 3 to 6 months, myomatous nodes decrease in volume by an average of 40 to 60%. Menstrual cycles normalize, while pain and the sensation of pressure subside.